forward to you, your inputs and the inputs of the rest of the people currently in this webinar. Thank you so much. And let me then hand the floor over to you, Patrick.
Okay, thank you very much, William, and thank you for having me here. So, when discussing the issue of vulnerabilities of migrants and addressing those vulnerabilities, I think the COVID pandemic has not only brought some new vulnerabilities, but even more so has really taken the lid off the existing vulnerabilities for a lot of migrant populations that have been there, and that many of us and many of those on the call, I'm sure, have been advocating for many years. But really they've come to a fore during this COVID pandemic and really been playing out and perhaps for the first time being recognised by society at large as really critically important factors. So considering the vulnerabilities, particularly in the context of COVID, but looking at the GCM, there's several different things I think we need to think about. One is that there are increased health vulnerabilities in terms of, whilst migrants have the same biological risks as citizens and non-migrant populations to the virus itself, their ability to be able to follow the public health interventions, the risks associated with crowded and cramped living conditions, collective shelters, dormitories, lack of access to water and sanitation and other services, really mean that for many migrants, there is heightened vulnerability just because of the social determinants that they find themselves in. And this can be, at their origin, because of the conditions that drive them to migrate, during transit, as well as in destination, where often their access to sort of basic hygiene, to social distancing and ability to follow those is impacted. Secondly, there's compromised access to health services in many settings where, and this has been highlighted in many situations with COVID, that because of lack of access to services, because of language barriers or cultural barriers, because of stigma and discrimination, because of either unintentional or intentional exclusion from health services, financial barriers, and other different factors that migrants, if they are affected by COVID or are affected by illness, can have a disproportionate vulnerability for there to be negative because of lack of access to healthcare, leading to delays in diagnosis, insufficient treatment, and the negative consequences of that. Thirdly, we're seeing, associated with the global economic conditions which are deteriorating, rising unemployment and loss of livelihood of migrants. And in many places, we're seeing countries also starting to enact policies to try and reduce the reliance on migrant workers. And so this is having significant impact on the ability of migrants, particularly migrant workers, to be able to cater for their basic needs for themselves as well as their families back at home, which links also back to impact on remittances. And again, that's having a significant impact on the vulnerabilities of migrants, but also their households and their communities back in home regions. So all of these factors combined are really exacerbating the underlying vulnerabilities, and I think the COVID pandemic is really highlighting those and making them significantly worse for people. There's also implications of the extensive travel and movement restrictions, which we're seeing globally. There has never before been, such extensive and such a long-standing interruption to global travel, which means in some cases migrants are stuck and unable to return home. In other cases, there's many more barriers that they face in terms of cost barriers, in terms of quarantine, in terms of testing and medical requirements to be able to move, which again is making them in more vulnerable conditions and more vulnerable situations, which when we think taking all of these factors into account in terms of health risks, in terms of lack of access to healthcare, in terms of socioeconomic impacts and in impacts on mobility, this creates the sort of conditions where migrants can be driven to have to resort to more risky behaviours in terms of unable to follow lockdowns, having to continue to find work, potentially having to become irregular in terms of their migration status if visa extensions are not being granted. And so there's these multiple different factors, I think, which are coming together to really create, unfortunately, a perfect storm in terms of the vulnerabilities facing migrants. And although in some countries there's been some improvements in terms of the COVID cases, And in a few select examples, which perhaps we'll discuss later, there's been some very good responses from governments and civil society in responding to these challenges for migrants. In many other situations, those responses haven't yet come to the fore, and I think a lot more needs to be done by all stakeholders, by governments, by civil society, by society at large, to really look at meaningful migrant inclusion. Because the reality is, if migrants are not being included within COVID response, if these vulnerabilities are not being addressed, then no one is safe until everyone is safe. And taking inclusive approaches to reducing those vulnerabilities is actually going to be improving public health for society at large. And I think by addressing the vulnerabilities for COVID and focusing on the current acute situation, hopefully we can look at changes to the way that migrants are treated in society, that these vulnerabilities are addressed into the long term, and to look at sustainable change. I'll just stop there because I think that's my 6 minutes, but happy to expound further as we go on.
For sure, Patrick, and I like what you've said, and I like what you started by saying is that there have been new vulnerabilities have come up, and I think that is the stark reality today of situation of many migrants. Uh, I am almost tempted to ask you, and I know what you might your quick answer might be, but I'll ask you to think about it, and I'll come back to you after some time. But uh, do you see change happening? Do you think that the GCM Objective 7 or even the SDGs has been useful for governments in this time of addressing this? You know, and uh, and if it has it been really pockets here and there kind of thing? Uh, or is this something that governments are learning from each other and moving, and I'm saying, where is the hope? Where is the hope? Is it going, we are going to, is if new vulnerabilities are there, and you started by saying the old vulnerabilities just got further exasperated kind of thing, right? So if we were struggling with so much of the old vulnerabilities and now a new one, top it up kind of thing, where is the hope? Is it with one or two governments? Is it in processes? And I know as a IOM, because of your engagement so much on the ground and with governments, do you see a shift? Can you say that yes, coming out we'll be in a much better position than when we got into it? So think about it and I'll come back to you.